Hi, I'm Dr. Deepti from Goa, and I'm here with baby Chakra, and we're going to talk about normal delivery and how to take care of yourself after normal delivery, and all of the things that you need to know when you just had a vaginal delivery. The first question that I have here is how can I help my body recover from a normal delivery? So I think the thing that we kind of miss is that we've been through such a life-changing, physically exhausting phenomenon, with a vaginal delivery, and everybody just expects you to get up and be up and about and take care of your baby, which is a good thing, but we have to remember to take care of ourselves. So, what are the ways in which you can take care of yourself? Number one, drink a lot of water. You need to be drinking at least 8 to 10 glasses of water per day. Remember, if you get dehydrated, you're going to be prone for a urinary infection. You're not going to be getting enough breast milk, so being hydrated is very, very important. Number two is to walk a bit because when you deliver a baby, be it by any means, cesarean or vaginally, you are prone for life-threatening blood clots, and drinking water and walking around is going to prevent that from happening. The third thing you need to remember is that when you're breastfeeding, you are putting out quite a bit to your baby. So you need about 400 kilocalories of over and above your regular diet. So that's about 2000 to 2800 kilocalories in total. You're going to feel hunger, like um, breastfeeding cravings are worse than pregnancy cravings sometimes. So make sure that you're eating enough to be able to breastfeed your baby well. Also, whatever wound you have, wherever your stitches are, if you've had a vaginal delivery, then obviously your vaginal stitches, make sure you take care of them well, and keep an eye out for signs of infection like redness, swelling, or discharge. Make sure to sit on a soft pillow. Try not to sit on a hard surface, and keep that area absolutely dry because you're going to be bleeding down there. So whenever you wash it for any reason, be sure to towel it completely dry. Another thing you got to look for is your breast health. So breastfeed every 2 hours. Watch for signs of engorgement, which may be in the form of pain or hardness, redness in the breast. If that happens, go and see your doctor or see your lactational consultant, get it sorted out because it can get pretty bad and pretty painful as well. If you develop cuts or cracks on your nipple, then your latching technique is probably not great, so you need to watch out for that as well. And last but definitely not the least, remember that when you deliver your child, your hormone levels completely change. And this roller coaster of hormones leaves you wide open for something called the baby blues. This is not depression. This is the baby blues is like anxiety, sleeplessness, crying spells, mood swings. All of this is completely natural, and it happens usually in the first 2 weeks just after you conceive, after you have your baby. And it usually goes away after 2 weeks. So be sure to take care of yourself, talk to your partner, carve out time for yourself, sleep well, and if it gets too much, then ask for help. Always ask for help. So the next question I have is going for walks and working out safe after delivery? When can I start? So the beautiful thing about having a vaginal delivery is that you can exercise as soon as you feel comfortable to exercise, as long as it was uncomplicated. When I say complicated is if you've had a forceps delivery or you've had extra stitches down there, or if you've had excessive bleeding, then maybe you need to sign off from your doctor before you start exercising. Otherwise, you can start as soon as you feel comfortable. You need to start something light, maybe go on walks. Once you are a little comfortable with walking, then you can start to do specific exercises. So remember that the two groups of muscles that really bear the brunt of your pregnancy are your abdominal muscles and your pelvic muscles. So you need to do exercises that target these two groups of muscles in addition to your general cardio. The abdominal muscles as well as the pelvic muscles, you need to do something called Kegels exercises. This is to prevent to strengthen the pelvic floor and prevent urinary leakage and incontinence and things like that in your future. Believe me, if you start doing Kegels exercises now and you do them every day, your 60-year-old self is really going to be really happy and really thank you in the future. And I know it's difficult to get motivated to exercise, but remember, there are so many things you can do. You can get a buddy with you, you can get somebody to exercise with you, you can talk to your partner, talk to your family, and help and get them to look after the baby so that you can carve out a specific time for yourself where you can exercise. You need about 150 minutes spread throughout the week. That is the recommendation. So if you can even do like 1 hour 3 days a week, and that should suffice. Remember to drink plenty of water when you're exercising, and you can even involve your baby in your exercise. Like if you go for a walk or a run, you can put your baby in a stroller. Or if you're doing abs or Kegels on the floor on a yoga mat, you can have your baby next to you, or sometimes even on your tummy, and kind of, make it fun for you, and like maybe even a bonding experience for you and your baby. How often should I go for checkups after delivery? So every doctor will have their own protocol about when they call you back, but you should go at least a week after delivery. Have a check on your wound, make sure that it's healing well. Remember, please go sooner if you think you have a problem. Don't try to sort it out at home. So the possible complications you should look out for are redness at the wound site, soreness at the wound site, oozing or pus discharge from the wound. All of these things are never normal. If your bleeding was kind of subsiding and then suddenly gets very heavy, or you suddenly soak an entire pad, or you pass large clots, you need to see a doctor. If you have any trouble passing urine, like you're not able to pass urine, or you're passing urine and you feel that you're not able to empty your bladder fully, that's a problem. Abdominal pain, fever, severe headaches, vomiting, anything like that, you should go in a little bit earlier. Otherwise, 1 week is good. The next checkup should be around 6 weeks, because that's the time it takes for your body to kind of almost, get to the pre-pregnant state. And then you should have one final checkup around 12 weeks if possible. And remember, during these checkups, you need to discuss with your doctor, number one, whether your breastfeeding is good, your breastfeeding is adequate, any problems and issues you may have with breastfeeding. Number two, your mental health. Very important to discuss this if you have any concerns with your doctor. Number three, talk about contraception, because it's very easy to get pregnant after having a baby, and you won't even, some people come back to us and they've not even had another period. They're already pregnant with their second baby. So contraception is another thing that you really need to discuss. And the last thing you need to discuss is exercise. What exercise you should do, um, what is good for you given whatever kind of delivery you had, and maybe a doctor can refer you to a physiotherapist or exercises, or direct you to the correct sources. I delivered twins a month back, but my body is still weak and I get tired very soon. How can I manage this? So, all you mothers of twins out there, you guys are rock stars. I mean, everybody romanticizes having twins, but it's not at all easy. Your complications during pregnancy are way more. It's a much more stressful time for both the mother and the obstetrician, trust me. And once the babies are born, it's not easy. So remember, when you have twins, you are more prone for things like anemia, vitamin deficiencies like B12 deficiencies. So your hemoglobin is going to drop, and that kind of makes you weak. You're more prone for things like diabetes, hypertension, thyroid issues. When you deliver, you will lose more blood during delivery than somebody who just delivers one baby. So postpartum, again, you're more prone for having a low hemoglobin. So the first thing you need to do is to get a checkup done if you're feeling tired 1 month post delivery, and check your hemoglobin and anything else that the doctor may tell you. Also remember that when you're breastfeeding twins, you require double the calories. So like I told you a little while ago, that if you're breastfeeding, you require 500 extra kilocalories for breastfeeding. If you're breastfeeding twins, you require 1,000 extra kilocalories. So imagine you have to eat that much. So what you can do is make a little 24-hour diet recall. Just note down, jot down what you've eaten in the past 24 hours, add up the calories that corresponds to, and see if you're eating enough. And if you're not eating enough, there's your answer right there. That's why you're so tired. I experience discomfort due to vaginal stitch given post childbirth. How can I manage this? Okay, so when you have stitches down there, see most women would have stitches down there, at least some stitches down there. So it's very important to know how to manage them. I know it's in a very, very awkward place, and remember that the vagina and the anus very close together. So it's very easy for bacteria which are normally present in stool to get into your wound and contaminate it and give you an infection. So you need to be extra careful after you pass tools when you have stitches down there. Always clean from front to back, okay? And once you wash after passing stools, remember to try to dry the area completely. So when I say dry the area, you take a wad of tissue and you kind of dab, because if you clean like this, if you rub, you might open up your stitches, and that's not good. Okay, so always dab. So one thing is to keep your wound completely dry and completely clean. Another good tip is to use kind of, to get those, like those ketchup bottles which you can kind of spritz. So you can take lukewarm water in one of those bottles, and you can add a little potassium permanganate. It's just a 35 rupee packet that you would get in any pharmacy. It's that salt that you use to decontaminate our wells. And you put a little bit in there, you get a nice light pink color, and you can kind of spritz it on your wound after you wash with normal water or in between, just to keep it clean. If your stitches hurt, you can even do something called a sitz bath, where you take this lukewarm water in kind of a shallow tub, and you put this potassium permanganate in it to get a light color, and you kind of sit in the water. So immerse yourself, your buttocks and the wound should immerse in that water for about 10-15 minutes per day, once or twice a day. That's perfect. That's enough. That'll keep your wound clean. The last tip I'd like to give you is what really helps is to sit on a donut pillow if you can get one. You know how what a donut looks like, right? So the pillow will be round with a hole in the middle, or any soft pillow. Try not to cross your legs till your wound heals, but keep your legs straight if you're sitting, on a bed or on the floor or whatever. And what really helps to soothe the wound and the soreness is cold. So a lot of women like ice packs, or some women have even taken their sanitary pads, obviously when they're fresh, I mean when they're unused, put them in the freezer and then use them for the bleeding. So that cold really helps. So I think that's all the questions we have. Takeaway message for all you guys who've undergone a normal delivery. Remember that you have to carve out time for yourself. I know we as mothers tend to be very self-sacrificing and neglect ourselves and give our 100% to our babies. But remember that when you give time for yourself as well, a happy mom makes a happy baby, because your baby can pick up on your vibes, and you need to be happy and healthy to be able to take care of your baby. Always ask for help if you need it, because it really does take a village to raise a baby. It's not easy, especially the first few months. And don't forget to follow me on Baby Chakra. I'm Dr. Deepti Pinto Rosario, at Dr. Bombastic on Insta. I will see you guys.